Well, good afternoon, everybody. Welcome to Open Classroom. I'm Janet Gillow, the Director of Professional Development for the Brown School here at Washington University in St. Louis. So happy to have you with us for Open Classroom today. For those of you joining us on the Zoom webinar, we've been using the chat already to say hello, but that will be enabled throughout the program, and we would love to have your questions and comments. We'll be curating them, and there'll be a time to bring your voice into the space at the end of the program. Before we get started, I want to let you know what's coming up soon here on Open Classroom. We will be back on tomorrow, that's April the 6th, featuring research done right here at the Brown School and also at Washington University School of Medicine in partnership with Special School District of St. Louis County, a program called Supporting Students with Intellectual and Developmental Disabilities During COVID-19. And then we'll be back next week on Wednesday, April the 13th, for the program Harnessing the Power of Digital Technology to Support and Improve Treatment Outcomes in Patients with Tuberculosis Disease in Uganda. And also we'll be having a program on Thursday, April 14th. Dr. Rupang Ann is going to be talking about artificial intelligence for everyone. So a range of topics, hopefully something for everyone and free and open to all. Today, I am joined by my dear friend and colleague, Associate Professor Jean-Francois Trani, who will be helping me moderate the chat, bringing your voice into the room during Q&A. And now it's my great pleasure to turn the microphone over to Barbara Levin, teaching professor here at the school, who's going to be introducing today's speaker. Barbara.
Thank you, Kelly. Welcome to the audience. It is indeed my pleasure. I will say I will be stepping out because I have to teach at 1 o'clock here Central Time. So I have to step away, but I didn't want to miss the opportunity to introduce you to a friend and former student, Kelly Moffatt. Kelly is an LCSW and a CCLS, and she brings considerable education and practical work experience looking at barriers related to inclusion and access and awareness of these issues from both a systemic perspective as well as a service providing perspective. And so you will be really treated to a great presentation today. I want to mention that Kelly graduated from here in 2009, I can't believe it, and has worked at Paraquad, our local organization, as both an education program manager, so implementing programs, and also as their civic engagement organizer. I remember she organized bus trips to Jefferson City to make sure that people understood the barriers to voting and getting people to the polls. That was one of her projects. I remember that one. She's also, for the last number of years, since 2005, a child life specialist at our St. Louis Children's Hospital. She was doing that while she was a student, and is now a psychosocial counselor at the Rehabilitation Institute here in St. Louis. She does a variety of other things, but at the end of the day, I think her heart is in advocacy. Not just legislative advocacy, but advocacy wherever it needs to be done, educating us, pushing our communities, pushing our societies for making systemic change and increasing access, and not only to mental health, but physical health, just access for all people, regardless of however they may be classified and categorized by the system. So it's my pleasure to turn it over to Kelly Moffatt.
Well, thank you so much, Barbara. That was a very, very in-depth introduction, so I appreciate it. And I want to thank Janet and the Brown School for inviting me to give this open classroom. I'm hoping that you all will take away some nugget of wisdom or maybe an aha that you hadn't thought of before this time together. So that being said, let's get started. So I thought I would start out our talk today with just a little bit of data on disability. A lot of times people don't realize that how broad a minority group disability encompasses. So you know, there's lots of things. We like to say that disability is a part of the human experience, and not really a thing that should be labeled, but that's not how our systems work. Our systems, you have to be labeled and unfortunately sometimes put in a box in order to get the services that you need, or that people that you support may need. And those kinds of things can be, the system itself can feel very insensitive, and not promoting understanding and overall respect of people with disabilities. One of the things that I always say when I'm talking about disability data, and I'll flip to the next slide, is that disability is the largest group, minority group in society, but you can join it at any time in your lifespan. It does not, you can have a disability from birth. Full disclosure, I fall into one of that category. I have cerebral palsy, but you can also have a disability, although other people might call it aging, because they're not comfortable with being put into the category of disability. So like my grandmother, when she had to use a walker, you know, I was like, oh, we both have disabilities now. And she was like, no, I'm just getting old. And so it depends on kind of what your frame is and perspective is. But ultimately, it's just an experience of life. Okay, it's a different experience of life, and it's a different experience for everybody. I can't, someone else with a different disability could give the same talk and have a totally different perspective and ways to attack it. So just to keep that in mind. And I tried to get the newest data that was out there, but one of the things that really shouldn't have surprised me, but it did, was this last bullet point here. Depression is considered the leading cause of disability, and it is one of the main global burdens of disease. And I'm thinking, how much have we seen a spike in that since this pandemic? We've been going through this pandemic now for 2 years plus, you know, and oftentimes people don't want labels, but they learn that if they have a label, they can get more of what they need, which if I had a magic wand, that is one of the things that I would change. I would change that you wouldn't need to be categorized to get the services at whatever level you need them. But we live in the world as it is, and we're working for the world as it needs to be or should be, right? So, okay, so I wanted this talk to be something that you all could hang on to as a take-home message. So I tried to come up with a acronym, because we all love acronyms, don't we? We know so many of them. And so I'll just add another one to your plethora of acronyms as you're thinking about, maybe as a service provider or someone with a disability who is maybe in our classroom today, just wanting to know a little bit more about how do I help people understand my experience. Okay, so I came up with the acronym ACCESS. So introducing that. When you're thinking about having, opening up the mental health space, the mental health services to people with disabilities. And remember, when we say disability, we often think physical maybe, or what someone can't do. We think about impairment, but we also have to think about there are people that have different disabilities that actually what society categorizes as their disability is actually a benefit to them. They have a positive way of working with numbers. That's a very big benefit. And if we would utilize the strengths of people rather than focusing on their deficits, I think the world would be a much more open place for people with disabilities. So A is for the Americans with Disabilities Act. I'm going to briefly go over that because not everybody knows that there is a federal law that protects the civil rights of Americans with all types of disability. So it was the first civil rights law that specifically addressed people with disabilities that experience discrimination. Okay. There are 5 sections of this law, but there's only a few that are really pertinent, in my opinion, to this topic today. So one is Title III, which goes over public services and accommodations. So anything that's available to someone without a disability also needs to be available to a person with a disability. And it makes for accommodations. So if you will excuse me, I'm going to get a little water here because I talk all day, but sometimes you need to do a little self-care, right? So, excuse me. Some of the things I thought that mental health providers could be thinking about in this realm is the physical space of their office or setup, okay? Is there a ramp, okay? Is there an elevator? Is there accessible parking? Is there braille on the, like near the elevators, things like that? Is there enough space for someone? Can you find interpreter services for someone who is deaf? Now, this has been a big deal with one of our service providers here in St. Louis. When I worked for Paraquad, we advocated with one of our big healthcare partners that people who are deaf needed to have, it was their given right under the ADA to have interpreters available at doctor's visits free of charge and things like that, because that's how they're going to know what is being said, and they can't make an informed decision or sign informed consent if they don't know what's being told to them. And using a family member, even though that's a good, like, in the moment solution, we don't know what a family member may be understanding as far as health literacy and things like that. So it is kind of, we do have here in St. Louis a very good resource for deaf interpreting for all kinds of services. So that's one of the things that I would, outside of physical space, because I think, like I said before, it's very easy for some people to say, okay, we have a ramp or we have an accessible spot for someone to drive and it's close to the door. But what are some of those other disability populations that we're serving that we don't think about all the time, that have a right to mental health services? A couple other recommendations under the ADA might be someone's your paperwork, maybe your intake form. Okay, do you have email versions of these forms? Or because someone who is blind could use a screen reader so they could accurately have someone fill it out for them, or they can, again, be informed of the terms and conditions of what they're signing. The other thing is things like, is there an accessible restroom close to your meeting space? Ask if there's any accommodations that the person needs. Is there anything, and you might want to break those. I know I use jargon words sometimes, but break some of those things down. So will it be helpful for you to have, space to set down your things in the office? Would it be helpful for me to move some chairs? These are things you can also ask on site, obviously, first meeting, but sometimes it's good to kind of get ahead of things, like especially if they are going to need an interpreter, who's going to provide that? Or you may need to do some research around your area to know how to get those services available to that client. And my big thing is to represent disability accessibility accurately, especially in this day and age. I mean, teletherapy has done wonders for removing barriers for a lot of people with disabilities because they don't have to go anywhere to receive mental health services, possibly counseling and things like that. But sometimes it is good to be in the space of your provider so that body language can be seen, and just being around other people with human experience after this long COVID haul that we've been through. So I encourage people who may be in private practice to represent accessibility accurately. I've looked around our area and I've checked into some different offices and things, and some of the areas may be accessible, but others, may not. And so it does limit a person's, not only does insurance limit these services sometimes, but also maybe different physical spaces and things like that. And I'm happy to answer questions, obviously, about that later, specifically, if people have more questions. But if you're unsure, make sure that you just, I would err on the side of not saying you're wheelchair accessible, because wheelchair accessible can be a power chair that weighs 500 pounds that needs an elevator versus a manual chair that someone could carry up, out of their car and up some steps. So those are just some things about that. The next two C's equal cultural considerations. Now, people, I am very steeped in the disability rights movement for multiple reasons. But a lot of people don't even know there is a disability rights movement, which to me is heartbreaking. But as a minority group, we do have a disability rights movement, and it is what ultimately created the ADA. I had the pleasure of working under two of the people, Bob Funk and Jim Tusher, who were instrumental in pushing the ADA to passage years before. Because the disability rights movement started in, it's the actual disability rights movement to get the ADA passed started around 1973. So, and I had a wonderful experience learning under those people. It arose because people with disabilities often started out in circuses and things like that because they were considered freaks. And that's how they made their first living, which is kind of, I had a little mixed emotion about the movie The Greatest Showman, because it's a great movie and it shows that people were allowed to make money and have that part of the human experience, but they were also exploited oftentimes. And and discrimination, as we all know from things that we see on TV daily, is very hurtful and traumatic to people who are in marginalized groups. So we need to be aware of those traumas that people may not even realize are happening to them. I got off on a tangent there, sorry, but at first the disability rights movement wanted to allow people to take care and control of their own lives, and the purpose was to influence social policies so that people were integrated rather than put away in institutions and warehoused. So we in this culture have we want representation just like every other minority or marginalized group. So nothing about us without us. Don't make decisions for us unless we're included at the table. And then one of the things you need to think about as a practitioner or a service provider or a friend is when and how did this particular client or friend become disabled? Because those perspectives are completely different. So I have had a disability all my life. I don't know what it's like to run, and I'm okay with that, okay? But someone that I work with every day at a rehab hospital knows what they're missing, and they're going through a possible grief process that we need to be sensitive to. So you just need to know where the person is or help them know where they are. Moving to that, to the E of our acronym, education. So education goes both ways, client to provider and provider to client. So there's a couple of different ways I break down how this mutual education works. Help the client explore their story. So for those of us, for me being a social worker, meet the client where they are. They may not know where they are. This disability, this experience may be totally new to them. And they may need to be validated that where they are is okay and that they are a human being. And even though whatever they're experiencing is totally different than their life maybe three weeks ago, it is worth being talked about and held in the space to work through whatever they need. The next thing is, and I have to, I tell people all the time that I learn more from my patients and my jobs than they learn from me. Now, I don't know if that's true, but my credentials don't make me the expert, okay? I have worked at the Rehab Institute for 8 years. I've worked with lots and lots of people with disabling conditions, but I never go into a room thinking I know what I'm gonna do to help this client, because I've never met this person. This is the first time I'm treating them. And I say that to them. I say, you know, I'm John Smith. I'm just meeting you and you're just meeting me. So I can teach you a lot about living with a spinal cord injury because I've done that for other people here. But I've never done that for you and I know nothing about you. So let's mutually learn and talk together and see where we can get as far as what you need and how we may be able to help each other in this process. It really does what the next thing says, which is rapport building. It really does that very quickly because you're not the expert telling them what they need. You're listening and you're providing that open space. As a provider or a friend, if you feel like there's an elephant in the room, and you're like, I don't know how to ask this. Like, I don't know about the disability. Like, they just had an amputation. I don't know how they feel about that. Go ahead and ask about it as gently or as openly as you can. The more I feel the more we try to tiptoe around things that we think are not appropriate to ask or things like that. It just makes things harder. Okay. The biggest take home that I can tell you is you're human. We're all human. Okay. We're people helping people. So I'm going to put my, one of my favorite oops, I messed up stories out there for you all. So I've been working at the Rehab Institute for 2 years. Okay. I work in a city urban area. So we get a lot of patients with gunshot wounds and things like that. This happened to be a young man who was hit with a gunshot wound and he was paralyzed and he was a quadriplegic. We had a wonderful rapport building session in initial assessment. We had everything going. And at the end of the session, I said, okay, man, let's fist bump it because I think we did some good work today. He's a quadriplegic. He can't lift up his hand to fist bump me. And I immediately, I froze and I wanted to run away or disappear into the floor. I guess disappearing into the floor would be easier than running away. But regardless, I said, I'm very, very sorry. I literally, in that moment, I said, I am so sorry. I wasn't even thinking. And you know what? Instead of leaving it there, I said, what is a special thing that you and I can create in this moment where I kind of stepped in it? That's just you and me know what's going on. And he came up with a dolphin click. So on the top of the roof of his mouth and his tongue. So every time we saw each other in the hallway, we would at each other because that was our fist bump, but it saved the day because I gave him the option. I apologized and gave him the option to create what he wanted, our communicative, I'm having a good day thing to be. Okay. So the next thing is support systems. There's lots of these diagnosis specific ones where if you have a certain disability, you're eligible for these resources. Nonprofits, like we were talking about, like Barbara mentioned, Centers for Independent Living, they came out of the disability rights movement and every state has one. Just remember, I'm sure there's many people in the room today that can speak to the differences because of geography, living in an urban area versus a rural area, and that some of these things aren't as available as they could be. And then things that are in society that like Social Security, vocational rehab, that encourage people with disabilities go back to school, go back to work, but there's differences there. And then Medicaid and the inherent barriers to all of those things. Quickly, the disincentive to work is baked into Social Security. So even if you go through vocational rehab and you get a job, if you're on Medicaid because you need attendance to get you out of bed in the morning, or someone does, and if you make too much money at your job and you're not watching that income level, the asset level is how it works in Missouri, you could be kicked out of that program and not have anybody to get you out of bed in the morning. Okay. The other thing is often people don't realize that there's marriage inequality. So if two people with disabilities want to get married, that's fine. But if someone with a disability marries a person who's able-bodied and say they make more money than their disabled spouse, they combine those two incomes, and then that disabled spouse may lose their Medicaid or their personal attendant services because together that couple makes too much. And if people are interested in those things, I can talk more about them with questions. System change, that's what we need. We need allies. A lot of people don't know that the disability movement is alive and well. And so we need people that are not just us, not only people to understand, but to also help those that are coming to you maybe for services, to tell them they have a voice to change some of these systems that are keeping them from doing things. When it's appropriate, when they're ready, give them ways that they can take action and be empowered. Okay, you can volunteer with a disability organization to learn more about different disabilities. If there's a need, you have a passion to address, and you don't have to reinvent the wheel. Find another person in the world, since we're opened up with technology, that'll have that same passion and support you in making some system change for not only people with disabilities, but any minority group. People with disabilities, I'm not speaking for all of us, but now I am. People with disabilities welcome partners for change, not pity. We don't need pity, we need partners with power, okay? That is the end of my PowerPoint presentation. And I think, as you see here, a very accomplished musician saying we need to make every single thing accessible to every single person with a disability. Here on the slides are my contact information. I'd be happy to not only obviously answer questions here, but if you have further questions or want to get connected to a disability related cause or whatever, I'd be happy to help you do that in the future. So thank you very much for listening. And there's some of my references as well. And that's the end.
Kelly, thank you so much for all of this work and these insights. We are going to pivot to Q&A now. For the audience, please do feel free to put your questions and comments in chat. And Jean-Francois, I think you're going to lead us off with the first question while Kelly takes hydration break. That is no joke, talking nonstop for half an hour.
Thank you.
Thank you, Janet. Thank you indeed, Kelly. Great presentation. I learned a lot. Very interesting and thought-provoking. And in fact, as you mentioned, we need to do more for inclusion. We need to do more for employment of persons with disabilities, and that's something we are interested in at the Brown School. We want to accelerate the process towards those two goals. And my first question is very pragmatic, concrete. What would you suggest? What would be your advice as a professional social workers, an alumni of our school, to help us improve in that direction, both inclusion in general of our students, of our staff and faculty with disabilities, and on promoting further employment, welcoming more people with disabilities in our institution?
I think just in general, not only providing the basics. I know when I went to the Brown School, it's much better now, but when I went to the Brown School, the original building, there was no automatic door button. And ironically, automatic door buttons, fun fact, people, are not required by the ADA. So anyway, there was a very heavy door to get in the bathroom, things like that. And so I think some of the things that I know keep people away from different environments is that if I have to struggle to get there and then struggle while I'm there, and what assumptions are people making when I'm doing my own, like crashing into the door, to get it open, that kind of keeps people, already gives the vibe of you're not welcome here. So I think doing things like that, I know when we got a bunch of we got a little bit of money, they came to me and another student at the time who was in a power chair and said, well, how can we use this in the most wise way? And so we said, we'll put an automatic door on the door, but then they also put an automatic door on the stall door, which meant that when you went into the stall, it wouldn't close all the way because it would keep hitting your chair. So it just kept bouncing open and then you're like, okay, not the best privacy. So I appreciate that we know that it takes a long time to start including and things like that. But I think just literally asking the community, maybe having different people with different disabilities come in and talk to them about if you want them to be students at the Brown School or if you want them just to be advisors of different things. I think a lot of times we're more empowered when we're asked to give our opinion or a voice, because we've tried to raise our voices alone before and it didn't work so well. That's the other thing about the disability community, I feel it here, is that it's siloed very much. People who are blind want to be called people who are blind, and they can advocate for their things. People who use wheelchairs need different things. And we could be so much more powerful if we got out of our own spaces and mingled together and said, there's some mutual benefit that we could have as a disability community as a whole. But I think we see that also in other minority groups as well, where things come up that kind of divide people, and it breaks my heart because I know with more power we can make more change, but it's convincing people that that it's safe to go and intermingle with each other to make the change happen. And that's where I think we need to start. Intersectionality is a big, big deal. And disability is the biggest minority group because it doesn't matter what your skin color is, what your this, that, or the other thing. You can have a disability at any time. And people are like, oh, that's such a downer. And I'm like, well, I don't think it is, but I've also had time to adjust. So
Kelly, I have several questions for you, but something that
Thank
you
you.
said just then, I was like, oh, say more about that. I absolutely agree with you that it serves no one when we're operating from a mentality of scarcity, from entrenched positions of I want this rather than value-based positions of I want a world that operates in this way or that way, and who are my natural brothers and sisters in that. But you said intersectionality is a very big deal, and absolutely it is. So before I move on to other questions, I just would love to invite you to say anything more about that you care to.
yeah, I have a colleague and a good friend of mine that is getting his second PhD in education, and he talks about how he goes out. He's a Caucasian male, but he is a very big ally of the Black Lives Matter movement because he's like, they do matter. I have friends, it matters to me. And so whereas some others may question like, well, what are you doing here? Well, don't you want as many people that are on message with you that get what you're asking for to be with you, regardless of what their position, what their purpose is, what they're trying to gain. I think some of that individuality, we're a little suspect, like, oh, what are you trying to gain? What are you trying to get from being here? And that's why this individuality that we've kind of found ourselves in, polarizing in our country, it's not helpful. Like, I was like, gosh, I talk to people who are blind because I've known that I've maybe discriminated against them unintentionally, things like that. But I don't sit back and just say, oops. I ask questions because I want to grow. I don't want to stay stuck and scared, so.
Absolutely that. And hearing you talk, I mean, the word empowered definitely comes to mind. And it sounds like for you, your participation in the disability rights movement has been central to finding purpose, finding voice.
Yeah.
And what I'd love to ask is if somebody on the call, or perhaps a family member on the call, hasn't really engaged in that way, hasn't, found their way of speaking up and being counted and pushing the needle, or whether either for themselves or maybe somebody who's an able-bodied ally that understands this is a human rights, social justice issue. At this point, I mean, the disability rights movement is not in the past. We know this is the past successes, but there's still work to do. So how could somebody plug in, and what might we be working on now as sort of goals on the horizon? Anything that you can share on that?
I would say to start at your, if you know where your Center for Independent Living is, one of their main pillars of why they grew those Centers for Independent Living up was because of advocacy, because when the ADA was passed, they saw how we had the leverage. Now we had to give concessions. Like, people are like, well, some churches are accessible now, but when the ADA was passed, churches were like, it's going to cost us too much money. We understand that you want to be accessible, you want to come, but it's going to just devastate us, So there are concessions, I guess, that you give, but you can. I even tell people, it sounds silly, but like, listen to a podcast. If that's where you feel comfortable. If your first thing is not to go to a coffee shop or find someone in a wheelchair with a seeing eye dog and say, hey, can I chat with you for a minute? Then find other ways to at least educate yourself, and then look for opportunities to engage in disability related things. So through a Center for Independent Living, for example, that would be kind of my go-to thing, is read up, do whatever you learn, however you learn best, do that, and then find a way to plug in that knowledge. Or ask around. You'd be surprised how many people in your purview have had an experience of disability. They may not call it that, but it is an experience. And maybe they need to be validated by someone that, yes, that struggle is real, but I want to come help you. I want to come alongside you. How can I do that? How can we work together? So.
Absolutely. So you mentioned podcasts. I'm imagining that there may be some people in the audience right now who are social service providers who would like to increase their skill in culturally competent engagement, sensitive engagement with people with a range of disabilities. Are there any things in particular that you would recommend as readings or trainings, or
Yes.
just anything that you would particularly endorse?
So on YouTube, there's Max and the Magic Pill, which is Max Starkloff, who was one of the he was local here in St. Louis. He started Paraquad, which is our Center for Independent Living. So they did a documentary on him called Max and the Magic Pill. There is also on YouTube a documentary called Crip Camp, and it talks about the history of things like that of the disability rights movement. There's 2 books that I put on my references, No Pity and Nothing About Us Without Us is actually a title of a book that I had to read during my internship with Paraquad. So, and I'm trying to, I'll have to maybe send out a list. I know I should have included it, but I have a list of like resources that go over different parts of like how sheltered workshops became a thing, because there's history behind that. Even though we're like, some in the community are like, those could be run differently or done differently. They rose up because parents of people with developmental disabilities were saying, what do my kids do after school? There's nowhere for them to go. And a lot of people don't know that history. So things like that. And Shannon, I'll try to find my list of books and podcasts that I tend to give to students and things. And I'll send it your way just in case anyone would be interested.
Thank you so much. And we have a question from Joel in the chat. Joel is asking, what's been the most helpful being a person with a disability serving other folks with disabilities and themselves have a type 1 diabetes and work serving mostly folks with mental health concerns?
So I'm sorry, what was the question?
What it has been the most helpful being a person with disabilities serving other folks with disabilities?
Yeah, it does, not to like toot my own horn, but it gives you an automatic rapport. So I work in an acute rehab hospital. So most of the people that come over to us have been in an acute hospital, so an emergency room based hospital, and they've had some life-changing thing. And everybody else, the PTs, OTs, nurses, techs, are walking in their room to provide them care, okay? That's not meant to be a slap in the face, but I'll tell you, it feels like a slap in the face. Because, but when I roll in, first of all, I knock on the door just like everyone else, and it takes me a minute to get in the door. So a lot of times I get, hello, hello, come in. And then they see that why it's taking me a minute, and they're like, oh, hi. And a lot of times they think I'm in the wrong room. And then I'm like, actually, no, I'm not a patient. I'm one of the counselors here. And I was just checking in to see how things are going. And one of the challenges is they'll say, well, can I see you? Can I continue seeing you after I leave here? Because you get it. And I'm like, okay, but here's the thing, like and I say it more gently than this and work it into a professional persona, but basically you've got to accept help from people that are able-bodied, because even though you think they don't get it and they're rude or they don't understand, you can be a part of changing that. You can educate them. It doesn't have to be us and them. It can be us, and they can walk all for the rest of their lives, but they can be a helper, they can be an ally. But I do get a lot of families and people that are saying, are you sure you don't want to go into private practice? And I would, and I may in the future, because there is a huge need. And because I work on the pediatric side, being a child life specialist, and on the adult side, being a LCSW, that transition of life, there's other things that I guess I'll throw out there for people. So if you're a parent of a child with a disability, they may be grieving when they come to you because their child wasn't born the way they thought they were going to, or every time there's a milestone, so-and-so's going to homecoming, but their son or daughter didn't get invited, or they did get invited, but it got on the news. Why is it on the news? Nobody else's prom dates get on the news. But when a person with a disability gets invited to prom, it's like, wow, how cool is that? How cute is that? We don't want cute. We want the same, So it is a benefit, but it also, sometimes that rapport building is harder because they'll say, well, you get it, Miss Kelly. You understand. And I'm like, oh, whoa. I've lived my life, my experience. And you're right, I may understand on a different level, but I don't know your life. I don't know what you want to focus on in the future. So you need to help me understand that. I can't do it. I can't just open my brain and give you all the answers. If it was that easy, I would have quit my job a long time ago. But yeah.
So Kelly, you do seem extremely well suited for the work you're doing. You seem passionate about it, knowledgeable, and like you're bringing a lot of strength. This is just me being curious. Did you always know this was the kind of work that you wanted to do, or was it a circuitous route to get here?
So everybody said, well, even Barbara, if she was on the call still, would say that, well, she said that my heart is in advocacy. I have a big heart for advocacy. And I do. That's where I started out. I started out after grad school, working with Paraquad. Actually, during grad school, they hired me after my field work, after my practicum, part-time, to do the Mo project and all that. So that's what I thought I was going to be, as a community organizer. And then I came over, so I worked at Paraquad, and I would come over to the Rehab Institute once a month to explain about our services and things like that. And I met the rehab counselor that was here at the time, because she would get all the students together for the class. And she was a paraplegic, and she had been in a car accident, gone back to school, got a certified rehab counseling degree, and had started the position. And so, irony of ironies, I guess, one day we lived in the same apartment building for a while. And one day she was in the lobby and she said, hey, Kelly, I'm thinking about, I want to move to the VA as a counselor, but I don't want to leave Tristle because I think they'll eliminate the position. And I wondered if you had any interest in doing direct practice. And I said, absolutely. I would love doing that. Oh my gosh. And so she's like, I'll call you when I turn in my 2 weeks. Make sure your resume is right behind it. And it was. And she gave me obviously a really good reference as well, but that's how that happened. So there are times I'm like, oh, it was so much easier to be an organizer. You know, there's so much paperwork, blah, blah, blah. But even my friends over at Paraquad, they've all kind of moved on. There's a different generation coming up now, but they all say, Kelly, we knew you were going to go direct practice at some point, because I was so into knowing the macro, but wanting the micro to know what was messed up about the macro and how can we change it. So sometimes I feel like I'm the only one down in the trenches still, but I'm not the only one. So, yeah.
But so important as a social worker to find sort of that level of intervention that that really is your skill set and speaks to your heart. The policy and the systems are where the individuals live, and some people are suited to do both. I've always been a macro practice social worker, so I mean, I feel that, and it's just always interesting to hear about people's journeys. One thing that you mentioned in your presentation that I was curious about, and this more likely is asking you to put your policy hat back on, the marriage inequality and disincentives is something that I have encountered before. It hasn't occurred to me to interrogate. Does that vary state to state because we're talking about Medicaid requirements, or is that really a coast to coast Alaska, Hawaii problem here?
No, I think it does vary state to state. So I know here in Missouri, and I should have, thank you for clarifying that, that the only people, it's funny because the only people, I've had people lose services, friends that have lost services, or that, and some of them, I mean, and so I've known people that, you know, like, someone who has a professional maybe background, and maybe their significant other is, you know, on Medicaid, to get personal care attendant, you know, help to get up in the morning or whatever. And that I've had friends go through VR, get their education, but they can only work part-time, if that, because if they go $1 over that asset limit, you're kaput. So I've known at least two couples that are friends of mine that have stayed like committed partners, but they can't get married because the state will immediately, and it's sad that you have to choose, and you're setting people up. You're saying, yes, you can get an education on the federal level through voc rehab, that the money is allocated through the state, but the federal government supplies that money. You can get your education paid for, and you can go, we'll help you find a job, but you can only work part-time, because if you work too much, we're taking away your way to get out of bed in the morning. How is that okay?
It's not.
Right.
It's not. And when policy and the incentives that it puts in place are really out of whack with our values and our investments, it makes me crazy. And there's more than a few of those that we can point to, where if we want people to be productive members of society, if we value family, which is one thing that nearly everyone can agree on. Sometimes our policies are really set to put them under pressure, not to support.
Well, and I've said at Jefferson City, I've said to people, you could have lots more taxpayers if you would just let people work. Because people with disabilities, I didn't put this fact up there, but once we are employed, we stay employed. We want to work. We don't want to be unemployed. So you could have a lot more tax money coming your way if you would just let these personal attendance pieces or some of Medicaid's pieces stay in place. And then if they get employer-based services, let them fall off of Medicaid. But, that's just a logical, way to solve a huge problem.
Jean-Francois, did you want to jump in with something?
No, I totally agree. And I can't even imagine if we talk about family, about children, right? Which is an extra, economic burden on the family. But if you lose your help, it makes it impossible to have
Well, and then think about, in Missouri, the transportation, and I'm sure other states too, like, if I lived on the East Coast, I could go states, I could work in one state and like you live in another. But here, like, there's things about, having children, like, I'd love to have a family, but I would have to, because I've chosen not to drive because of, my level of disability or whatever. But I'd have to, if the kid got sick, like, I'd have to try to find a bus to get to them, and I don't want to put all that. I don't want to create a challenge just to say, see, I can do it, but also it's not equal at all. And those are things that people, I've had to explain to many family members, significant others, like why I think the way I think on certain topics like that, because, and, it's good because having these conversations, you hopefully gain allies. And they're like, oh, I never thought of that. That's why I threw in the marriage inequality piece, because a lot of the OTs and PT students that help me out in the morning getting ready and stuff, they're like, oh my gosh, I didn't know that. That's so wrong. And I'm like, yeah, so you want to help me like make it, change it, but, it's just, we've got so much work to do to level. And that's what the ADA, it's like people think that, oh, you have the ADA, it leveled the playing field. It started the leveling of the playing field. It by no means leveled the playing field. But we've seen that with other minority movements too, that people think they do one thing and it's all good, and it's not.
So true.
Absolutely.
So Kelly, thank you so much for spending this hour with us, for the time that went into your presentation. Wonderful audience that we've had. Jean-Francois, always such a pleasure to collaborate with you, my friend.
Thank you, Janet.
But
Thank you.
we made the time go so very quick. Recording of this presentation will join others on our YouTube channel. So if you'd like to review it or share, that will be available. But Kelly, I do love where you left us. The ADA was a beautiful beginning, and it was just the first step. So
Right.
much work to do, and we need everybody to do it together. So there's love coming into you, Kelly, on the chat. And so grateful for everyone joining us. We hope to see everybody at another open classroom very soon. Please stay healthy and safe out there, everybody. And we're going to wish you a good day now. Take
Thank
care.
you, Janet. Thank you, Francois.
Thank you, Kelly, so much. Thank you, Janet.